We are back on Morning Line. Thanks for joining us. Nick Barris here, coming to you live this Wednesday morning. If you're joining us on Facebook, welcome to you. It's nice to have you with us. And please message us with any questions or comments. There have been some good ones already this morning as we talked education. Also, we'll put the phone number up if you want to join in the conversation with our next guest. I haven't seen him for a few weeks, but I think he's terrific. Dr. Calvin Smith, good morning, sir. Can you hear me?
Hey, I can hear you well. Good morning, Nick. Good to be back.
Nice to see you. Good to have you back. And again, you over at Meharry, and you've been very involved with the COVID testing. What are you doing of late? I know you had been out at Nissan Stadium for a long time there, kind of, being part of the testing that's happening there. Where are you now, and what are you up to?
So I've actually been out sick.
Oh.
But I'm still associated with the Nissan site. I plan to get back out there later this week. We have made some minor changes. The hours are now 7 in the morning to 1 p.m. In light of the heat and humidity in our typical Nashville summer. We want to be cognizant of that for our workers. But otherwise, it's much the same. We've had some great volunteers from the National Guard to come help us to do some testing as well. But we're keeping it rolling right along, and we're seeing big numbers. But it's good that people are being tested.
Yeah, I have to ask. You said you were out sick. Was it COVID?
I was tested several times. All of my tests were negative.
Okay.
I had a flu-like illness, and I'll leave it at that.
Okay, I had to ask on that, especially because of where you work, but I'm glad to hear that. That's great. Well, it's interesting, Doctor. I had gone and had a COVID test myself, and this was probably 3 or 4, maybe 5 weeks ago over at Nissan. I don't think I saw you out there that morning, but it was interesting. I went over there along with Vicki Yates, and this was kind of at the point where we were moving to phase 3, and things were looking good before we've fallen back here now. And I literally was the only person there along with Vicki. I mean, I zipped through in less than 5 minutes. There was no line. I wanted to get a test again recently. I went back by there. And of course, since then, I think just about everywhere they do testing, there are long lines, which I think is probably a good thing.
Yeah. Phase 3 definitely saw an uptick in people being tested, as people were able to get out and about. A lot of workplaces were requiring it, a lot of nursing homes. If you wanted to visit, a grandma, grandpa who's in the nursing home, et cetera, all of those required it. So we saw an uptick from that.
Okay, and a couple quick questions before we get to some phone calls and comments online for you. First one, and maybe I'll ask them together and you can answer them both. One, when I went, they just swabbed one nostril. Someone told me, well, they really need to do 2. And then the other question for you is, are they using the new swabs yet? I think we reported on the fact that now they've learned that it's possible to do the testing with a shorter Q-tip type swab that doesn't quite have to go quite as far up to detect the virus. What are you hearing on those two fronts?
Those are great questions, because our process did change very shortly after you came to be tested, Nick. So the first process that we had was a nasopharyngeal swab, and that was the one, as a lot of my patients kind of politely refer to it as a brain tickler. That was the one that went all the way to the very back of the nostril, to the throat, and was the one that only needed to go into one nostril because of the invasiveness of it. The test that we have moved to is the anterior nares test, so the very front of the nostrils. It still is invasive. It's a lot like the flu test, but that one, yes, it does need to go into both nostrils, and so we go into both nostrils now. And the Q-tip is not necessarily shorter, but we go a shorter distance. So we used to have a marker that we used to kind of let us know if we were going far enough. We don't need to go anywhere near that far any longer, but we do need to make sure that we're getting into both nostrils to get secretions from both.
Interesting. Okay. And our last guest was Beth Brown with the Tennessee Education Association. A lot of people following us on Facebook as well and wondering, you've been on the front line. I don't know if you have children yourself. I'm wondering, okay, your thought, though, as a health professional and what you've seen with the testing, has the debates happening statewide, nationwide about kids returning to school. I mean, what is your take on it at this point, as opposed to maybe keeping children home for virtual learning? Or if you have some loved ones that are younger, what would you do?
Yeah, so I'm an uncle and a godfather. It's a very tough decision. As it stands right now, in large class sizes, I just can't see it occurring. We are resuming our medical school classes for our students. And even in those situations, we're trying our very best to limit those kind of interactions with these adults. With children, it's difficult to get them to wear masks, and all those kind of things. And in smaller class settings, 6 to 7 students at a time, where it's staggered or something along those lines, I could see it maybe working just a little bit better. But I really, for the safety, because again, it's not, even if kids get the flu, because I saw a governor of a recent state say something along the lines of kids get COVID and they'll survive. Well, there are repercussions to it. I mean, people are having blood clots, losing legs, even children, things of that nature. So, it's not as simple as that, and they can pass it along to the adults still. So I want us to have an abundance of caution. But that's just where I sit. Obviously, I don't have a position to tell a parent certainly what to do. But I would not. I personally would not.
Okay. Just curious what you thought, and you're someone whose opinion I respect. Let's go to Charles. Charles, good morning. Do you have a question for the doctor? Hi, Charles. See, he should be there. Hang on, Dr. Smith. Charles, go ahead. Are you there, Chuck?
Yes,
Okay, go ahead, buddy. What's your question?
Well, over a month ago, I had to test for the virus. But what they done, I'm a little concerned now, listening to all these reports, that they swab me in the mouth. Is that sufficient?
Oh, and he said he had a mouth swab, which I guess I had not heard about. Is that something you've heard of?
Yeah, in a few instances, I have heard of doing a swab through the mouth. As long as it can, the problem with doing the mouth swab is a lot of times to get an adequate sample for COVID, you're going to an area that causes a gag reflex, causes people to feel like they want to throw or potentially even throw up. So a lot of times, we want to, that's the reason we went through the route that we went through for this test. Nonetheless, if they were able to get a sample and the sample came back either positive or negative, that usually indicates that there was an adequate sample and that, it's still valid. The problem again is even when you have a negative test, if you've had additional exposures, all those kind of things from day to day, week to week, it can change. And if you continue to have symptoms or you're having symptoms, I would act as if. That's the best advice I can give to anybody who thinks they might have COVID and maybe they were tested and that's basically, I'll tell you, Nick, that's how I acted as far as my job was concerned and everything else like that. My tests were negative, but I acted as if because I had a lot of the symptoms that were consistent with it. And I would advise other people to do the same thing, to quarantine yourselves until your symptoms go away, things like that.
Makes sense. Yeah, I think that's good advice. And I'm glad that you didn't have it. What are you hearing, doctor, with regard to, and we talked about this last time you were on, and that's been about a month or so maybe. Is there progress? We keep hearing the updates on, vaccines and all that, which is great. We can talk about that later. But are we getting any closer to having a test that can really come back with a result? And I'm talking like in 5 minutes, because, for instance, that is something I would think the NFL and the NBA, which have a ton of money, would invest heavily in, because then they could test a player, bingo, just before a game, boom, get out there and play, you're clear, as opposed to having to wait. What's the quickest we can get a result back on now?
So right now, the quickest we can get a result back is about 20 to 30 minutes. I actually had that test performed when I first fell ill on the day after July 4th, actually was the day I fell ill. And I went to the emergency department at Metro. And now this is not available to everyone. And I want to be very clear about that because, again, the false negative rate for it is still pretty high. But these tests are out there. They're working on them to try to get them out there to people as fast as possible. Obviously, these tests involve a little bit more in the way of equipment that is a little bit more expensive and things like that. So insurance will probably have to be involved in it as opposed to the free testing that's available in the city. But these tests are slowly rolling out. The more we know about this virus and the specifics about this particular novel virus, the quicker we can get these kind of tests. But the technology's out there, and I agree. Things like the sporting teams and the leagues, they certainly are. They have a reason to be invested in something like that, and I think that they probably would be very interested in that as well.
No, I agree. And the one thing you said there, even with the one that you had, is I wanted them to come about. But you worry about the false negatives, which can be devastating. Someone all of a sudden thinks, okay, well, I have symptoms. Oh, I'm negative. Okay, it's false. And they go around their grandparents and they get sick and die. I mean, that's the worst case scenario. So, I mean, even now, as far as the testing that's going on, say, at Nissan and the like, what's the percentage of false negatives there? I would imagine, I hope, that sure is very low. Those are pretty darn accurate, right?
Yeah. The latest that I've heard is it's somewhere in the neighborhood between 5 and 10%. Which for something, a novel virus, again, we've never seen anything like this before. And so everything's brand new with the testing and everything like that. That's a good percentage. Okay. 5 to 10% negative is an excellent percentage for a new test.
Gotcha. All right. Well, and the new ones, the new ones that you talked about coming, hopefully they'll make sure that they have them in the place where they need to be. All right. Let's take a call from Ronnie. Ronnie, good morning. Hi, Ronnie.
Good morning. I got a couple of questions.
Okay.
I don't see why you got to go up both nostrils, and I wish they would come up with something where you just spit in a cup and be done.
Yeah, I hate to think that there are some people that would like to get tested but aren't because they fear the uncomfort that comes with the nostril swab. Look, I am not a tough guy. My wife will vouch for the fact that I am the biggest, scaredy cat when it comes to this stuff. I had it. It's uncomfortable. It doesn't hurt, but it's uncomfortable for a few seconds. That's it. But trust me, if I can handle it, anyone can. But that's where it stands, right? I mean, we're not spitting in cups at this point.
Well, it's funny because I have a very close friend of mine who's an ER doctor, and he is a proponent of eventually getting to the point where we can get a sputum test. He thinks that's something that can happen. It would be wonderful if that were. So trust me, after having 6 tests done, I would love to be able to spit into a cup and have it done. The 2 nostril test, even though it is both nostrils, we're not going nearly as far. I'll tell you the biggest difference for me. I see a lot of adults who are kind of squeamish about it, but the kids are tolerating it a whole lot better when we do just the front portion of the nostril, and that's the real litmus test for me. If the kids tolerate it, surely me as a 41-year-old man, I can do okay.
As we go to the break real quick, Cynthia asks a question I think many other people wonder, even though I think for me, I'll take a swab over a blood test. But blood tests, are they able to detect the virus, or is that just to detect antibodies after the fact?
Yeah, so far it's still just to detect the antibodies after the fact.
Okay.
That's as much as I know. And to be honest with you, the news about that was pretty disheartening most recently, in that it looks like some people are not, depending on the severity of your illness, if you don't have a very severe case, you're not holding on to the antigen for very long. Which kind of puts a dent into the whole herd immunity thing. Yeah,
we'll take a break. When we come back, that's one of the things I want to touch on with you, the questions about a vaccine and how effective a vaccine can be if now we're finding that having had COVID doesn't necessarily inoculate from you, because that's what a vaccine does. It exposes you to the virus so you get the antibodies. And I'll let you explain. And you made a point there where if it's a mild case, you may not have protection for maybe more than a few months, whereas maybe the vaccine will give you enough that you get protection that's permanent. We'll take a break and touch on that and take more from you on Morning Line right after this.